My comment is, as early career nurses and midwives, we commend the adoption of the Global Strategic Direction of Nursing and Midwifery 2021-2025 with Resolution 74.15 at the 74th World Health Assembly. We also commend the commitment to jobs and the prioritized policy actions to attract, recruit, and retain. But the insufficient action means this remains a global health emergency. The insufficient action means there is still a shortfall of more than 8 million nurses and midwives, potentially a million more. The insufficient action means no universal health coverage. Our lived experiences tells us that our early career colleagues are leaving the profession in the droves. This is directly due to the impact of unsafe working conditions, unfair pay, and a failure to meet the basic needs of well-being. Progress towards the SDGs and health for all simply cannot be achieved without strengthened and a valued nursing and midwifery workforce. Could any of you here, honestly, you would recommend a career to nursing and midwifery to your loved ones? I couldn't. This global workforce crisis directly impacts the communities we serve and care for. Our question is, how are you holding yourselves accountable to the commitments you made in 2021 by 2025?
If I could now turn to the representative from Thailand.
Thank you, Sir David. My comment will cover 3 areas. First, the problem stream. High-income countries have 6.5 times health workforce density that of low-income countries. Africa has 4% of global health workforce share, despite they have a quarter of global BOD. During COVID, after COVID, the world witnessed alarming migration of health workforce from LMIC to high-income countries by both government and private recruiter active recruitments. Women comprise 67, 3/4, or 2/3 of the health workforce yet face 24% gender gap pay. This out-migration weakened the health system, in particular the 55 countries listed as support and safeguard by WHO. Further, SDG 10.C said, by 2030, we commit to reduce to less than 3% of the transaction cost of migrant remittance and eliminate remittance corridor with costs higher than 5%. My clear message to Juan Pablo, you're from the World Bank. Dr. Tedros, Sir David, Juan Pablo, I have a bad news. The global average cost increased from 6% second quarter of 22 to 6.3% in quarter 3, 22. This is according to World Bank 2022 report on remittance price worldwide. I give you a little bit more details. The largest increase in migrant remittance is seen in Germany, from 5.8% to 7%. The UK, from 5.6% to 6.3%. Italy, 4.3 to 4.7%. Japan, quite high, 7.6% to 7.8%. And Canada. Alarmingly, remittance from South Africa incur an average cost of 15%. So that means international workers in South Africa, when they transfer money through, for example, Western Union, they have to pay 15% surcharge, leaving 85% to their family in Malawi, in Mumbai, in Manila. This reflects a double burden of neo-colonization. I'm sorry to speak this very bluntly. Health workforce working in OECD and other countries send their salary to their family in their home country, in their original country of origin, have to pay an average of 6.3% of the amount of their earning that they limit. This go to transnational money transfer agencies. So is it not an exploitation? Ask your heart and your conscience. All member states need to work together to achieve USC. We felt that health workforce is critical to make health system functioning. Now my second part, quickly, is on the root cause. They are both push and pull forces, and that the scientific community has unpacked the complexity of push and pull, jointly work together and result in international migration. No need to say what are the push and what are the pull. You can review and use PubMed to search. Now the solution stream. WHO is very good in uncovering problem and root cause and produce solution in papers, in the guidelines, but solution rests squarely on your shoulder, on member state shoulder, through constructive collaboration. I think one of the untalked issue is the remittance corridor, that migrant health workforce has to pay 6% of their limited amount of money back to their home countries. I wish to conclude that protect, invest together is the solution for everyone. Over to you. Thank you.
I'm sorry, but this will be my final invite for a contribution from the floor. But if I could ask the member for the United States to speak, and if I could encourage you to be brief, and then we can hear from the panel one more time. Thank you.
We are able to hear it? Good, great. Thank you very much for the opportunity to speak. I want to say the United States government is strongly behind the Protect, Invest Together theme and focus. We see the investment and protection of healthcare workers as a benefit to the world. It's a benefit to health security. It's a benefit to the economy for all, and understanding that this is an economic investment as much as a humane investment is critical. That is why we have sought to lead as the largest country contributor to WHO, to World Bank, to UN agencies like UNICEF, Global Fund, Gavi, and to individual countries as a bilateral donor. Last year, President Biden launched the Global Health Worker Initiative for us to ensure that we're in the United States government working across these investments to make sure that we're supporting closing the gaps in the protection and investment in health workers. This is a critical moment for this. The WHO just a couple weeks ago came out with results indicating in the latest surveys, 84% of countries are still reporting that there are gaps in providing essential health services, gaps that were the result of disruptions from the COVID pandemic. We've seen essential health services decline from immunization and the 67 million children without critical vaccinations that UNICEF recently reported, to maternal and child health declines, TB deaths that have risen, and so on. Primary health workers are the key priority for investment in these spaces. They're the last paid, they're often the first cut, and that can't be the case as we face the ongoing challenges of the economic hangover of the pandemic. Finally, on the point of protection, we must discuss what it means under conditions of war. Protection includes making clear that attacks on health facilities and on health workers must not be tolerated. It is a war crime. and I hope we can all join in roundly condemning this. Thank you.
Thank you. Now, we have a hard finish at 2:15, so if I could invite Dr. Tedros to conclude by bringing the call to action. Dr. Tedros, please.
Thank you. I would have loved, actually, if I can, sorry for, pushing on you, but ILO, maybe just 1 minute from me, and then I will do half a minute only.
I am at your service.
Thank you.
Right, so my timekeeping is more permissive than I thought, so we have the ILO, and I'm looking.
Thank you very much. Thank you very much, Dr. Tedros and WHO and also esteemed panelists for this important roundtable discussion as a follow-up to the 5th Global Forum on Human Resources for Health. The COVID-19 pandemic has underscored the importance of the health and care sector for economies and societal well-being in times of crisis and beyond. However, it also showed that key workers, such as health and care workers, are often undervalued and their essential role for society is unrecognized. Resilient health systems require bold steps to invest in the health sector and the people that work in them. More sustainable investments in employment opportunities in the health sector are required, accompanied by measures to provide decent conditions of work, to ensure resilient health systems, adequate preparedness and response to public health crisis, and equality in access to health services. We will only achieve this if we preserve the development gains that are currently under threat by the impact of COVID-19 and geopolitical challenges, and accelerate progress towards achieving the SDGs. To do so, we need to break existing silos, invest strategically in transformative and sustainable health, employment, and social protection policies, both at country and global level. Only a holistic approach to health can ensure that it is fully underpinned by social justice. The ILO firmly believes in the unique impact of joint, international, and multi-sectoral cooperation and coordination to address health workforce challenges. The ILO, together with WHO and OECD, through the Joint Working for Health Program and Multi-Partner Trust Fund, are already working successfully to assist governments, social partners, and key stakeholders to expand and transform the global health and care workforce for achieving universal health coverage. This existing interagency collaboration aligns with the new Working for Health 2022-2030 Action Plan and could be further strengthened to fully leverage multi-sectoral cooperation coordination. We thank our partners for their support to the joint ILO-OECD-WHO Working for Health program, and we remain committed to drive forward a health and care workforce agenda that is aligned with the SDGs, the goal of universal health coverage, the global call to action for human-centered recovery from the COVID-19 crisis, and the recommendations of the High-Level Commission on Health, Employment, and Economic Growth. Thank you very much.
Thank you. Dr. Tedros.
No, thank you. Thank you, moderator, for your flexibility. I think one thing that's very clear is we know the problem. We know the root cause of the problem, and we know the solutions. What's missing is action, and as Sana reminded us, accountability. I think if we can focus on action and accountability and a sense of urgency as well, it can be done. So thank you so much to all. I think the forum and now this platform are a reminder of the magnitude of the problem, and I hope we will work together to make a difference. So enough talking, and now time to act. Thank you so much.
Contributions. Thanks also to you for listening and your contributions. Have a good afternoon. Thank you very much indeed.